Hi, I'm Dr. Steve Coates. I'm a clinical neurophysiologist based in the UK. I'm also the CEO of the charity TeleEEG. Today, I want to talk to you about TeleEEG in general, but also our experience of TeleEEG in Ecuador. And I have nothing to disclose. There 65 million people worldwide live with epilepsy. Most of these live in low and middle income countries, and of these, 3/4 are not treated adequately to contain their epilepsy. This is a busy slide, but it's often used to show the disparities in the treatment gaps between various countries. It's based on a systemic review in 2009, which was quoted by the World Health Organization Bulletin in 2010. We focus onto the right-hand side of the slide. You can see that the high-income countries have treatment gaps less than 10%. Ecuador is classed as a middle-income country, and depending on the data, the treatment gap is anywhere between 30 and 80%, still pretty poor. Some of the countries on the left side of the slide have a treatment gap of 100%. This includes Bolivia, which is actually not shown on this particular slide. Why is this treatment gap so large? Well, individuals with the skills to diagnose and treat epilepsy are in short supply generally, but particularly in under-resourced countries, where you may not even have a neurologist or a clinician trained in epilepsy in the entire country. There's a general lack of medical equipment in some of the low and middle income countries, and in particular EEG machines. Where EEG machines are present, these tend to be concentrated in urban areas. Education can be a problem. Sometimes even now, epilepsy is believed to be due to witchcraft and spirits. Also, diagnosis and treatment can plain and simply come down to cost. Not just the cost of the actual diagnosis and treatment, but also the price incurred by leaving your work for 1 or 2 days to travel the distance to get to a clinic for the treatment. Finally, when a person might get actually treated, the medication may be ineffective or even the wrong type. So we have this big problem with the treatment gap in the developing world. But we believe that there may be a solution using innovation from technology. And at TeleEEG, we have a plan to try and overcome this treatment gap. Epilepsy is, of course, a clinical diagnosis, and will rely heavily on the history and clinical examination. But there are other investigations which are also important. Bloods, EKG, imaging in particular circumstances. And also today, of course, a lot of people have access to smartphones with videos, and video recording of seizures can be useful to the managing clinician. And finally, we have EEG. So why do we need all of these investigations? It's frankly because we need as much help as we can get. Studies in the UK have shown a misdiagnosis rate of between 20 and 31%, and this is reflected in other studies, including in the US. These are some examples of misdiagnosis. So this baby on the top of the recording was misdiagnosed as croup, and the young girl on the bottom of the recording was misdiagnosed as epilepsy. I think you can see quite easily that the little baby has an epileptic disorder without recourse to an EEG. If you look at the young girl on the bottom of the recording, the EKG is shown torsadis de pointis, not epilepsy. So the EEG can be very useful in the diagnosis of epilepsy. The EEG equipment itself has advanced over the last 100 years. Whereas previously it used to be a paper recording on big machines, nowadays the EEG can be carried out on a laptop or even a small portable device, as in an ambulatory recording. And this is what we strive to produce: an EEG of good quality, which will help determine whether or not a person has epilepsy. So a routine EEG should answer the 4 questions. First of all, is it epilepsy or is it something else? If it is epilepsy, is it focal epilepsy or is it primary generalized in nature? Or is it an epileptic encephalopathy? This is what the World Health Organization has to say about the use of EEG for routinely diagnosing epilepsy in non-specialized healthcare and low and middle income countries. The bottom line is that a poor recording or a poorly interpreted recording can be worse than no EEG at all. There is some evidence that over-reporting of EEG can lead to worsening outcomes for patients with epilepsy. However, now we have the internet. As of January 2022, 4.95 billion people use the internet, and that represents 62.5% of the world's population. Last year, 2021, 57% of the developing world was using the internet, and it's presently growing at 500,000 people per day. We can use this. At TeleEEG, we use technology to try and help reduce the treatment gap. So we provide laptop-based EEG machines to clinics in need. We train the local staff to produce routine EEGs on their patients. Also, if local expertise for interpreting the EEGs are unavailable, this can be provided remotely by uploading the EEG to one of our servers, where one of our volunteer interpreters will read the EEG and send the report back to the clinic. So this is one of our TeleEEG promotional
Over 50
videos.
million people in the world are affected by epilepsy. Of those, around 80% are in low or middle income countries with limited resources to either investigate or manage their epilepsy. It's important to accurately diagnose epilepsy. We measure the brainwave activity. To do this, we use a machine called an EEG machine. With an accurate diagnosis, we can then target medications to treat the epilepsy correctly. Correctly treated epilepsy can lead to 70% of patients being free from seizures. This equates to around 35 million lives saved in the world. At TeleEEG, it's our aim to make accessible, high-quality investigations and epilepsy management to all potential epileptic patients in the world. What we do is provide EEG equipment. We also train local staff on how to record an EEG. Then one of our volunteer, highly specialised interpreters can read the EEG, produce a report and send it back to the clinic. This report can help direct the management of this patient for the best possible control of their epilepsy. TeleEEG has been carrying out this service now for almost 10 years. Within this time, over 15,000 EEGs have been reported and lives changed.
So this is a map of the world showing some of the poorer nations in orange and red. The TeleEEG service was initially established in response to a request from Nepal in 2012. At the time, there were limited epilepsy services in Nepal and only a few EEG equipments based in Kathmandu. We were able to train local staff in a hospital in Dhulakel, not too far from Kathmandu, in running routine EEGs. These were uploaded to a central server, and essentially I would read them. However, word got round and the demand for an EEG service grew. So today we have over 40 clinics in around 26 different countries. And we've reported over 15,000 EEGs worldwide. Our metrics compare pretty well to those of high-income countries. Latin America in general carry a significant treatment gap, and Ecuador in particular. So Ecuador is one of the smaller countries of South America. It's in the northwest. Its landmass is slightly greater than the UK and has got a population of 17.7 million. Quito is the capital, and Tena, the place that TeleEEG visited, is southeast of the capital. Ecuador generally is noted for its beauty and for its biodiversity. Ecuador is notable for its burden of epilepsy and also for its geography and demography. Ecuador is part of Latin America and the Caribbean, with 6.34 million people living with active epilepsy. Latin America and the Caribbean countries rank third in the epilepsy global burden of disease. That's behind sub-Saharan Africa and Central Asia. And of the Latin American and Caribbean countries, Ecuador has got the highest burden of epilepsy-related disability. A recent paper on the burden of epilepsy in Latin America and the Caribbean called for telemedicine, among other tools, to help improve epilepsy care. So access to care in Ecuador is in part limited by its geography. There's a mountainous terrain, with the capital Quito being at 9,000 feet. Sometimes roads are impassable due to landslides. As far as demography is concerned, although Spanish is the official language, there are 13 other indigenous languages. Also, 37% of its population live in a rural setting, which is associated with an increased treatment gap. Thanks to the work of the International Neurology Foundation, we at TeleEEG were invited to go to the hospital Jose Maria Velasco Ibarra Hospital in Tena. And this is a 100-bed hospital with a catchment population of around 280,000. So we installed a Cadwell 3 EEG machine, and we trained 3 ITU doctors, 6 interns, and 6 pediatric doctors and nurses on carrying out routine EEGs and uploading these EEGs to our server for analysis. Although there was a language barrier, it was overcomable, but there was an issue with the availability of staff. They have to balance their training with clinical commitments. Usually we would train staff for 2 days solid, carrying out multiple EEGs on as many volunteers and patients as we could get. However, in this case, some doctors and nurses were only available for afternoons. Another limitation was that clinicians routinely carried out their own investigations rather than delegating. So they would carry out phlebotomy and EKG. They would therefore carry out their own EEG. Now that, of course, meant that they were away from clinical work on the ward during this time. Nevertheless, I'm pleased to say that the first TeleEEG upload from Tenor Hospital was carried out on the 2nd of February 2022. Summary. There's a large treatment gap in low and middle income countries. Ecuador has got the largest burden of epilepsy in Latin America and Caribbean countries. And the treatment gap can be potentially closed by the intelligent use of technology. There's still a long way to go. At the moment, we have 48 hospitals in 26 countries awaiting our help. I'd like to also take this opportunity to thank our partners who have helped to make our work possible, and also our volunteer consultants who've given their time in reporting EEGs from the clinics in the developing world. So thank you for listening, and I would be happy to take any questions.